Hi everyone, welcome to HSAM 6060. I hope that you are having a great summer so far. I hope that continues for you, and this class will just enhance your activities for the summer instead of putting a damper on them. So HSAM 6060 is healthcare policy, law, and politics. So we really cover a lot in a very short period of time. Time seems to go much more quickly in the summer as well. So we cover a lot very quickly. So we really focus a lot on policy. It's kind of the root of our course because law is what comes from policy typically, and politics play such a big role in the development of health policy that policy is really our root. You'll have, and I'm not sure where this is showing on my camera, so hopefully you can see it, but this is your textbook that you want to get. It's Health Policy Making in the United States. And I don't think it comes with any sort of special enhanced access or anything like that. So the book's been around for a little bit. You should be able to get a used copy for a reasonable price. But there is a lot of good information in there that will hopefully continue to help you throughout your career. Or you can always rent a book, those types of things as well. But that book's very important to our class, so you want to make sure you get that. And what I'll be doing, and this is a little different than what I've done in the past, is doing a lecture each week. If in my classes, actually, most of you have been in one class of mine previously, and I'd use, instead of written learning summaries or infographics or those types of things that I know some of my colleagues use, I do a weekly video, an ed puzzle, where I usually will talk about what happened the week before, maybe some issues with quiz questions, that kind of stuff, and then talk a little bit about the week to come. I'm kind of flipping the script on that a little bit this term by doing that video at the beginning of the week. So even here in week one, obviously we have a video. They'll be done in the Ed Puzzle format, which obviously you know because you're in that right now. And then we're gonna do a lecture. We're gonna cover material because I think that that's one thing that we're lacking a little bit of. This video is probably going to be a little long because I'm doing some intro stuff, but in the weeks to come, it shouldn't be. It should be about the same length of time as the Ed Puzzles were. I do still want to make sure that we're covering quiz questions that are missed, though, as well. So if I find that, if only one question is missed, I might just put up an announcement about it. Here's the one quiz question that was most frequently missed, and here's the information about it. However, if there is a quiz where there are several missed, or I'm seeing that maybe you're not clear on a topic, I'll just put up another video. That it wouldn't be for a grade, it wouldn't be an ed puzzle, it'll just be a video to give you that a little bit of additional information. We have to read so much in these classes that I'm hoping that we can lighten that load for you and maybe just sit and listen for a little bit and watch the video, and that would be helpful. So this week, we are going to talk about, well, let me just hop in the classroom here first. So this is our classroom. Obviously, if you're watching this, you've already been in here. But a few things that I want to point out, because I think I arranged mine perhaps a little bit differently than some of the others. So at the top, you'll always get an outline of the week to come. In some weeks, I have some additional optional reading on topics if you're particularly intrigued in what we're looking at that week, or for example, there's one week where as an optional reading, I have some appendices at the back of the text about Medicare and Medicaid. Some of you work in the healthcare industry and live Medicare and Medicaid every day. Some of you aren't as familiar, so you can refresh yourselves with that information at the back of the book. So there's sometimes you'll see some optional reading. Obviously, you'll see the readings and videos that you have to do. This is our textbook, the longest textbook. And then additional readings that are required. This will match up with your syllabus. I would suggest the syllabus has the dates in it. You can certainly follow one or the other or both. Then we'll have, this is where this lecture will live when I'm done recording it. Our introduction this week is, because we all know each other for the most part, your introduction this week is going to be kind of a fun introduction question, and I'll post up in there as well so you can see mine. But if there is anybody in the right now, as of this recording, we don't have anybody in the class that's not part of the HSA program. So most of you know each other. I know you. But if there is somebody that's not, sometimes we have nursing students in the MSN program take our courses. So if there's someone from any other program, welcome. I'm more than glad to have you here, and you're very welcome in our class. But if you could provide just a short introduction of yourself, because although we kind of all know each other, we've been together for a bit. But also please answer our fun question, because hopefully that nice little icebreaker, and we can get to know each other on a different level a little bit. As you may remember, both this one and this discussion, I use Flipgrid in my classes. So it's not going to be every single week this term. There are a couple of assignments that are more well suited to a written discussion board, but generally it's the Flipgrid format. So if you have questions about that, if you're having issues, please feel free to reach out, email me, call. I have in my syllabus, there's a number you can text me at as well if you prefer that. So any of those are fine, but please reach out if you're having issues with Flipgrid and getting that rolling. And then we have a quiz this week as well. So quizzes, important note on quizzes, they're timed. They're 10 questions, but you get 20 minutes. So it's a timed quiz, and just be sure to when you have the opportunity to go in and take the quiz, do that. You can't save it and go back. You have to have that time to take the quiz and be able to finish it at that time. So you can't go into the quiz prior to the time that you're going to take it and finish it. Okay, so let's talk a little bit about, that's not what I'm looking for. This is what I'm looking for. I just realized I didn't introduce myself, because I am under this assumption that we all know each other. But if anyone doesn't, is in the course that isn't part of our program, or maybe has been so overwhelmed that they don't remember, it's a busy couple of years in our program. I'm Dr. Jillian Harrington, and you are stuck with me for the next 8 weeks, the second half of the summer term. So we'll get you rolling. Also, one quick note: if you are my advisee, or I think there's even some that aren't my advisees. And for the class as a whole, you're going to be hearing from your advisors, or your someone that has been assigned to you with regard to your internships, because you will all be starting your internships in the fall. So we'll be reaching out. Make sure that you get back in touch with whomever it is that reaches out to you. Like I said, if you're my advisee, you'll hear from me. In most cases, you'll be with your advisor, but we did have to shuffle some folks around a little bit, because it was fairly not even as far as advisors and internships. So make sure you get back in touch. We want to make sure that we can get something set up for you to start as early in the fall as we can. Okay, so let's go through some of this information. I'm probably going to fly through some of these, but I did want to just go over some of the basics and just share some general info. It might be a little easier than obviously we want you to read the textbook, but sometimes it's easier to talk through it a little bit. So health is, obviously we're talking about health policy. So we want to consider, what is health? So being healthy is not necessarily, according to the World Health Organization, is not necessarily just about not being sick, not having an illness. Health is a complete focus, complete physical, mental, social well-being. And this is why we're really seeing a shift in our industry right now from acute sick care, which is what we've done forever, and has been very expensive, and not necessarily making us healthy, it just makes us not sick, to a more preventative medicine approach and a wellness approach. So even if you are physically well, maybe you work out every day, you eat healthy, you don't have any chronic illnesses, that doesn't mean that your mental wellness or your social well-being are being met. And in order to ultimately avoid illness in the long run, you need to have all of those met, because at some point in your life, things kind of start to compound. And we want to make sure that we are, as an industry, focusing on that total well-being. Now, oftentimes, much of this kind of overall wellness has fallen to the public health industry and health policy based on that. And this is where we're trying to shift that. The folks that take care of you when you're sick should also be making you more well. So we're trying to shift that. Cost of health overall is really there's a significant difference across, and we've talked about this in previous classes, perhaps not my class specifically, but Dr. Hampe, Dr. Frendak have talked about this issue where you see here, the United States, this was a few years ago, it's gone up considerably since then. Well, I think we have a slide with that info as well, but about 17% of gross domestic product is being spent on healthcare, as opposed to, let's look at Sweden. Sweden is known to have a very effective and efficient health system, 9.6%. So huge difference. And then ultimately, and we won't look at this in this class, but when you get to the Population Health Coordination of Care class, where you're also with me, we will take a look at just that overall spending in countries and how that relates to outcomes. So as we see this high spending, more money doesn't mean better outcomes. In these countries here, in these mostly Western countries, the spending is much lower. We're the highest by far, and in many of these countries, their outcomes are much, much better. So it's important for us to look at that. One of the things that we're struggling with in the U.S., and I'm sure other countries are as well, are health determinants. So making sure health determinants are all of those different types of factors that impact health or affect health. So you'll hear a lot throughout this class and other classes about social determinants of health. And this is part of this. Overall health determinants can be more than social factors or socioeconomic factors, but health determinants is a huge part of health policy, because we're trying to take policy and turn that into law, or even just policy that can be implemented at the local level, that can then impact these health determinants, getting people in situations from a socioeconomic standpoint as well as a healthcare access standpoint, et cetera, making sure they have the means to get to hospitals or physicians if they need them. But all of those impact the overall health of the patient. There are lots of different, and there's more in the reading in your book about different determinants as defined by different people. And again, this has always been a public health issue, and it shouldn't be. It should be a healthcare issue, but it should be all public health. Traditional healthcare sector, we should all be involved, and that's where we're moving now. But you'll see, like the Healthy People 2020 movement, if we want to call it that. But it's not really health policy, but it leads to health policy in the hope that we can help to reach some of those goals of Healthy People 2020, get to the goals that were set in that document. And there's more about that in your textbook. So what is health policy? Obviously, this is kind of a structure here. Policy overall is going to be some sort of a authoritative decision made by some authority that's going to guide action, hopefully guide behavior. When we're talking about public policy, which is generally what we're talking about in this class, these are policies that have been enacted by legislative, judicial, executive branches of government. And there's an exhibit here we'll take a look at in a second. So we'll kind of dig down even further. Health policy is going to be those policies regarding health. So things that will that push us toward a more healthy environment, or put us in a position to where we can become more healthy overall. This is the exhibit I mentioned. This is in your textbook as well. So we'll see, there we go. So we'll see that the legislative branch formulates policy. So they're the ones that create policy overall, and we'll talk a lot about that process in the coming weeks. The executive branch, those are, legislative branch, House and Senate. And on the federal level, House and Senate. Very similar structures in most states as well. The executive branch implements policy. So they put in place the policy. They are the ones responsible for signing off and saying, yes, this is what we want to have done. So obviously, the executive branch in the federal government is the office of the president. And then the judicial branch, and we actually are not going to read the chapter about judicial, but there's certainly reading in there if you want to dig in a little bit further. But the bulk, we have all of these laws in the U.S., not just on healthcare related issues, but we have law, we have administrative law, which we'll spend some time on next week, I think. But sometimes these conflict because there are so many laws, or we have conflicts between a law and the industry, etc. So the judicial branch is responsible for interpretation, and then they, through their process of interpretation, even create more laws because they create a body of case law. The biggest body of law in our country is case law. So it's much larger than public law or administrative law. The biggest body of law that we follow is case law or common law, which comes from the actions of the judicial branch. So very important thing to keep in mind. So some challenges that we're currently facing from an industry standpoint with regard to health policy, how policy can help us, affordable health care, informed, empowered, engaged patients, safe patient care, and having that patient care be evidence-based, having a delivery system that's accountable. This is an issue that we've seen time and time again, and how can we enhance policy to impact that? An improvement in learning-oriented environment, innovations that are evaluated for their effectiveness and then rapidly adopted, and also having reliable info with regard to quality, cost, population health, etc. So these are all the types of challenges that health policy can help us push forward and hopefully make some positive change. So the forms of health policies can come from a few different types of a few different forms. Forms of health policy can come in a few different forms. So the one we probably think of most frequently is a law. So laws, you think about the Medicare program. The Medicare program was put into place via law that came from the federal government. Same with Medicaid. It was put into place via federal law and is implemented under state law. So there's some mixes there. However, there's a large kind of book of policy that we deal with in the healthcare sector that are regulations. So this is what's known as administrative law, and we'll talk about that a little more in depth. Again, I think it's next week. But the best example that I can give of an administrative law is if you've ever looked at HIPAA and the HIPAA law versus the requirements under HIPAA. So HIPAA was passed in '96, and it had a multitude of titles, but one small section of HIPAA was what was called the administrative simplification. And in that law, this is a public law, put in place by our legislature. In that law, there was a small section, administrative simplification, that said, okay, Department of Health and Human Services, you need to develop regulation on protecting privacy, protecting security, among other things. So when we think of HIPAA in this industry, for the most part, we think privacy and security. Those are actually regulations and not law. Regulations are considered administrative law and have to be followed, but they are not HIPAA. HIPAA law is completely different than privacy and security. Those are regulations that were written by the Department of Health and Human Services, and we'll talk about that process upcoming in the class. Judicial decisions as well, like I said, can become law as case law. So these are all the different types of policies. So there's a couple categories of policy that the textbook talks about and I think are important. There are allocative policies and then regulatory policies. So when we think about allocative or allocative policies, these are policies that are providing benefits to some group. So I'm going to flip over here for a second. I'll go back to that slide. When you think about a subsidy, these are some of the subsidies that came out of the American Recovery and Reinvestment Act, or ARRA. And as you look at these, like for example, Medicaid received $87 billion in additional federal matching payments. So, like I said, Medicaid is managed by the states. That is what's considered an allocative policy. There is some net benefit to a group. Continuation of health insurance coverage for unemployed workers. So all of these things are, focus on that. So through the ACA, we saw those implemented as well. But sometimes we have regulatory policies that are really designed not to provide a subsidy, but to impact behavior. So a regulatory policy, the HIPAA privacy regulations are a great example of a regulatory policy that are trying to influence the behavior of those of us that work in the healthcare industry. And there are many, many more types of regulatory policies, but that's just an example. So the one thing that we had, I'd mentioned there at the beginning, health determinants. Health policy is very focused on health determinants right now. It's really a hot button issue because we see so many people in our towns, in our areas, other areas outside of where we are, maybe large cities, that just don't have the wherewithal to be able to kind of fit within our healthcare industry right now. Maybe they don't have access because there aren't providers available. Maybe they don't have the ability to pay for services. Maybe they have a negative social environment, socioeconomic environment. So they may be able to get to care. They may be able to get prescriptions for the medications, and they may even have Medicaid that was going to pay for that. But when you're living on the riverbank, all of those things are not really going to make a lot of difference in your life. So how can we in the health policy sector help to deal with some of these issues? So some of the issues are, physical environments, behaviors, social factors, access to care. Those are all the types of things that we're dealing with. So this is just a little exhibit, very simple, but health policy is hopefully going to help us deal with some of these things. Like, for example, if we have patients that just can't access care, they're too remote, there aren't providers in the area, those types of things, then perhaps we look to, through policy, create situations where telehealth is covered under maybe their insurance plan, or maybe they have a free telehealth clinic in the area where the provider doesn't have to be there physically. They can be elsewhere, and those patients can overcome that determinant. Things like physical environments. We're seeing hospitals and healthcare organizations help people to get housing, to help people to get food. So this is, I had a student last term in the cohort that's right ahead of you guys who did a big project for his first part of his internship about prescription for food was the title of the project, and how you can, through policy, deal with the lack of, if maybe you live in a food desert, or maybe you just don't have the wherewithal to be able to get food, then, how can we deal with that? Or you can't get healthy food. Healthy food tends to be much more expensive than a dollar hamburger and a dollar fries at McDonald's. So how can we encourage people to eat more healthfully, etc.? So if we can, through policy, deal with some of these determinants, that's going to lead us to health, hopefully. I'm going to hop past. I'm taking more time with this than I wanted to. So obviously some social factors that can affect health, chronic unemployment, absence of a supportive family structure. And this is where you may have a patient that comes in that you can do for them when they're in your facility, but maybe they need that support outside and they're not getting that from family. So that's where you can have social workers, case managers getting involved, a patient-centered medical home environment where people are getting support, not just while they're in your office or in your hospital, but outside of that. Poverty, homelessness, discrimination. So it's, obviously folks that are in poverty just don't have access to the types of care and services that those that have means to access it do. So it's something that we really need to keep in mind in trying to push forward. So we talked a little bit about money and how the U.S. is grossly over what all others are. I think this was the number that they had stated in the previous slide we were looking at. But so it's projected for 2019, we're to be projected at about 18.1% of gross domestic product, about $12,000 per capita on healthcare. And you think about, maybe you personally don't spend $12,000. Most of us do not. But that means on the flip side, there are many that are spending much, much more than that. So it all obviously all balances out. But such a huge amount of money that we're spending, and it's projected to continue to increase, obviously. So a little bit of policy making context. We've talked about kind of the roots of health policy. How do we push things forward, trying to deal with social determinants or other types of health determinants, but we need to have a context in which to do that. So at the federal level, public sector health policy making is governmental, based on the three branches. So the executive branch, they're the ones that, like I said, implement and enforce laws based on the president's authorization. Maybe it's signing a law, maybe it is an executive order, etc. And obviously the president has a cabinet, 15 department heads on that cabinet. And one of the most important ones to our industry is the Secretary of the Department of Health and Human Services. So they are the folks that administer Medicare and Medicaid, but they're also over the FDA, the National Institutes of Health, or NIH, the CDC. So they're over all of those. And they're the ones that really put laws in place or put regulations in place to answer laws written by Congress. But then also they're the ones tasked with enforcing them. So Department of Health and Human Services is very important to us. The legislative branch, obviously, is the Congress. It's made up of the House and Senate. I'm not going to go over all of these details, but know that they are, if you think about it, if you really think about it, so we have 535 voting members in our House and Senate. And how many of them have any knowledge or expertise of healthcare? So we'll talk a little bit here in a second about how important we are to this process. But when you think about all of these people that are making these decisions, driving health policy, literally driving health policy, they're the ones that have to push it through. They need expert advice, and we can provide that to them. And then the judicial branch, as I said, they're the ones that interpret law. So they'll make interpretations of law, and they'll also try cases, which will then create case law. So, and like I said, with that, sometimes dueling rules with regard to different areas, they can help to decipher that for us. States and local governments, very similar. Not as, obviously, you get to the local level, you don't have all of that structure that you do at the federal level, but laws are made in a very similar process. And again, when you look at your state representatives or those that represent you in local government, how many of them have healthcare expertise? Probably not that many. So it's important that we play a role in helping to inform them. We've already talked about the Medicare and Medicaid and the federal and state governments. Implementation of the Affordable Care Act is also a huge, probably the biggest health policy since Medicare, I would say. And pushing that forward was the responsibility of the federal government. I'm going to skip through a couple of these. I will post these up in the classroom so you can refer to them if you would like. I do want to mention this, though. So the local government's role in health policy is very important because you think about what the local government does for you. They regulate smoking. As someone that came from New York just a couple of years ago, I'm shocked that you can still smoke in any public place. Here in Pennsylvania, you can, there are restaurants that you can, bar restaurant type places that you can smoke in. You can smoke at in random public places all the time. There are still places where I see smoking going on inside of, for example, the casino downtown here, Rivers Casino. You can smoke in there. In New York State, that would not be allowed. We do have casinos in New York that you can smoke in, but they're on sovereign land. They're not governed by the state of New York. So if it's in New York State, not on sovereign land, not on Native American territory, then the Clean Air Act in New York State applies, and so you can't smoke in those places. So it's really interesting to me that that local government and state government haven't made that push here in Pennsylvania to protect workers. As a person, I can choose not to go in there, but workers are really absorbing that secondhand smoke every day, and that's just makes a bad situation. The maintenance of cleanliness standards in restaurants too is something that's managed at the local level. Your local health inspectors will come in and inspect restaurants. In some areas, they actually assign letter grades, and they have to post them in the window. I don't know if they do that here or not. I don't know that I've seen that, but that process that's health policy as well. It's keeping us healthy. So those types of things we rely on our local governments to do. One thing I want to talk about with health policy is kind of the characteristics that it has in common with a traditional economic market. So when you think about an economic market, there are products and services available, and pricing and cost, and it all is based on supply and demand. And in these markets, you'll have negotiation. So let's say I go down to buy a car, and I'm going to negotiate with them, and there's going to be give and take between both of us. If I'm looking to buy maybe a Tesla, which is very in high demand, I'm going to pay sticker price. If I'm looking to buy something that's not maybe a car that is not as popular, maybe it's not good on gas, it doesn't have good emissions, has lots of problems there, I might be able to get it for cheaper because I can negotiate. There are two approaches to negotiation. There's cooperative negotiation, where ultimately it's a win-win. The organization and the buyer and the seller are ultimately both, there's going to be a win-win situation. Whereas sometimes in negotiations, it's a competitive negotiation, so it's win-lose. One side is going to get the benefit, the other side is going to miss out. So there's lots of different types of negotiation. Policy markets are a little different from economic markets because in an economic market, supply and demand, I'm the buyer, and it's my money that I'm using to buy with, to give to that seller. Whereas in a policy market, it's kind of an indirect link. However, there are still a lot of similarities. Negotiation between parties, that supply and demand comes into play, etc. So there is a lot to be to kind of compare there. So demanders of health policies, the folks that are on the demand side of that equation, individuals. So sometimes an individual will play a great role in the health policy process and work to push to demand health policy in some areas. And you'll see this with I can think of, and unfortunately I can't think of their name off the top of my head, but oftentimes when we have a situation where someone has actually here in PA, there's a law in place. It's at the state level where a person was impacted negatively by unexpected, like a situation where it was a service. This is hard to describe without going into the whole story, but so I'll tell you the story. A patient went to a facility expecting to pay the same amount as their friend that came there that had Medicare. This patient didn't have Medicare and didn't have insurance, so there was there was some discrepancy as to what would actually have to be paid. If you have Medicare, you're paying a much decreased rate for your services, as opposed to a patient who has no insurance. You're paying at the highest level, unfortunately. So what happened in this case was, let's say the Medicare patient pays $2,000 for this service. That's what this person had saved to have it done. They got the bill and it was $10,000. So they took action to have a rule put in place where providers can't charge any more than Medicare rate to certain types of individuals. And I don't know if it's been passed. I don't know if it's still in process, but that was driven by an individual that had a negative situation. So that type of health policy can be driven by an individual. Certainly, if someone's impacted negatively by something in the healthcare sector, they often will become very motivated to drive that agenda. Organizations can also drive health policy. You think about large organizations like exist here in the Pittsburgh area, UPMC, Allegheny Health Network. They have lots of resources and could push the policy agenda at the state level and even the federal level if they wanted. The most effective demanders of healthcare are interest groups. So I always think of the American Hospital Association and the American Medical Association as probably the most powerful people with regard to policy that directly impacts providers. They're the ones that are in the ears of the politicians saying, here's what you need to do, here's what I want, here's how I can help you, etc. So very, very important to keep in mind. Legislators, so they are suppliers of health policy. So we've got our demanders. Legislators are those that supply it to us, and oftentimes, like right now, we're approaching an election year. So you're seeing a lot of hubbub coming out of the executive branch on changes that he wants to make. Now he said that before he was elected 4 years ago. Now he's saying it again, like changes that he wants to push forward. So you see. Especially when it comes to re-election time, you'll see them pushing the agenda of the health policy market. Executives and bureaucrats. So presidents, obviously, as we talked about, governors, mayors, all of this area, they are all suppliers of healthcare, of health policies, but also the judiciary, and we've talked a little bit about that as well. Influence is something that's really important, as I had talked about back here, so I can go back a few. These interest groups can provide a significant amount of influence. So sometimes they have, sometimes they'll fall within this situation where it's expert power. They have that expert power. As I said, all those people in those legislative seats, they know nothing about the healthcare system. They know what they learn from others. And some of them do, but most of them don't. So they rely on this expert power to really push forward the policy agenda. But sometimes it's legitimate power. So you think about someone like the president. He has the power to put in place executive orders that could make massive changes to our industry. Now, usually if there's something that would be controversial or negative, that would then go to the courts to be reviewed, but ultimately they do have that power. Sometimes there is reward power, so it's a situation where they have the ability to reward somebody for their decisions or their actions. So if it's kind of a situation where maybe the president makes a deal with certain legislators. Okay, if you push this through, which is what I want on my agenda, I'll help you push this through. That's what you want on your agenda. So that happens every day, sadly, in the legislative and the executive branches. So that's it. That's all the slides I have. Probably you're happy to see the end of it because it was a lot longer than I had originally planned. But hopefully it was helpful. And again, I will continue to do these each week, but in the future they'll be much shorter. Because we won't have all of that initial info, and there's a lot of background in this, so we'll be much more focused in our learning moving forward. So any questions, please let me know, and I look forward to talking with everyone in the Flipgrid and answering any questions you might have. Also, this week you'll be receiving a doodle poll for our synchronous session. We do, in my classes, I only do one, and because we have all of this other interaction that's kind of face-to-face. But we will do one. It's in week 6, and it's to go over your final project, kind of talk through, debate some of the topics, etc. So that'll be in week 6. So I'll be sending out a doodle poll here shortly so that you can let me know what dates you're available. Okay, talk to everyone soon.